Hi, today we'll be discussing the mental disorder of schizophrenia. Schizophrenia is a severe mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combinations of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. Schizophrenia is a disease that typically begins in early adulthood between the ages of 15 and 25. Men tend to develop schizophrenia slightly earlier compared to women. Most males become ill between 16 and 25 years old, while most females develop symptoms several years later, and symptoms among women are noticeably higher after the age of 30. There is no cure for schizophrenia, but is highly treatable through therapy and medication. The overall U.S. spending in 2002 on schizophrenia was estimated to be around $62.7 billion. Schizophrenia approximately affects 1.1% of the population over the age of 18. 20% of patients lived in supervised housings like group homes. There are over 15 new medications for treatment of schizophrenia currently in development by different biotech and pharmaceutical companies. Now let's take a look into the life of a schizophrenic. Hi, this is my son, and he's been having some mental issues, so I just wanted to check him into this facility.
I've been having a lot of voices in my head, like telling me to do some really violent things.
Okay, you can take a seat and I'll take him over. Come on. Can I have you take a seat right here on this couch?
The doctor will be with you shortly.
God, Dimitri,
can
do
you
something
sit
useful.
right?
Go
You're
kill
so
your
stupid sitting
family.
here.
Go
Just
jump
go
off a
out.
bridge.
Hi, who's my next patient?
Hi, your next patient is Jeremy Smith. Some symptoms are delusions, hallucination, disorganized thinking and speech, extremely disorganized or abnormal motor behaviors or negative symptoms like losing interest in personal hygiene, doesn't change facial expressions or speaks monotone or loses interest in everyday activities and lacks the ability to express emotion. There are no known causes of schizophrenia, but the researchers believe a combination of genetics, brain chemistry, and environment contributes to the development of the disorder.
Okay, thank you. Hello, Jeremy. My name is Stella Zinman, and I'll be your doctor/therapist for today. So, Jeremy, what are the voices telling you?
There's different voices. They're all, sometimes they tell me to be really happy and I get really excited all of a sudden. At other times they get really crazy and they get really violent.
Okay, have you been sleeping good?
I don't get a lot of sleep because of the voices and sometimes I hallucinate.
Okay, do you take care of your personal hygiene? You know, showering, brushing your teeth? Just for my
I don't know, I lose track of time a lot.
Okay. The voices, do they have names? Do you know them personally?
They're usually different, but some come back to talk to me.
Okay. Who's like the main voice?
So there's this one girl, she's like really angry and violent, and she was always telling me to do these bad things, but there's another voice who tells me to not do that, to do what she's telling me to do.
Right now, what voice is talking to you?
It's the girl, the really violent one. Her
What's her
name's Clarissa.
Have you been eating?
The voices won't let me eat sometimes.
What do the voices tell you?
Some voices won't let me eat certain things even when I'm hungry.
Okay, so I'm gonna go get your mom and figure out your diagnosis, and I'll be back in a few minutes. Hello, Dr. Nirmal Ray. I have a patient here with schizophrenia, and I sent you his files and my diagnosis, but I'd like a second opinion. So could you please look over those files? Thank you.
Hi, this is Dr. Nirmal Rai giving you a call back, and the patient does indeed have schizophrenia because he has experienced the following symptoms such as hallucinations, delusions, confused thoughts and speech, trouble concentrating, different movements, and overall struggling with the basics of daily life.
Hi, Miss Smith. I need you to come with me so I can talk to both you and Jeremy.
Okay.
Have a seat. After talking to Jeremy, I've come to the conclusion that he does suffer from schizophrenia. He's going to have some physical exams done. He's going to have tests and screenings. He's going to have a psychiatric evaluation, and some possible treatments that you might want to consider is medication and therapy sessions with a specialist on schizophrenia.
There is more than 200,000 U.S. cases of schizophrenia per year, and this just happened to be one of them.
Yeah.
Schizophrenia in children is rare. However, schizophrenia can emerge at a very early age, even before puberty. Among people with schizophrenia, the estimated average potential life loss is about 28.5 years. Medical conditions that may contribute to higher mortality rate include heart disease, cancer, pulmonary disease, and diabetes. Individuals with schizophrenia have a 5% lifetime suicide risk. The rate is far greater than any general population. Personal treatment plans include psychiatric therapy, medication management geared to individuals with first episode psychosis, family education, case management, and work or education support, depending on the individual's needs and preferences. Thank you for tuning in to this portrayal of the life of a schizophrenic.
Where are you going, Jeremy? I'm back.
I'm back.
Demetrio, stop.
What?
Stop.
Do it again,
Just
do it again,
because
do
of
it
your
again, do it again. Do it again.
We gotta go.
Go.
Okay, a diagnostics.
What, fool?
I like thinking.
The voice.
Have you
Wait, hold on. I'm sorry.